Okay. Are there any milestones or, changes that happen, you know, feeding a certain number of times a day or sleeping through the night or something like that or eating more calories or something that can influence when you get your cycle back? Or, or are there strategies you have that you give to people to try to help get things moving?
Yeah, that's a really great question. So oftentimes night weaning is suggested as a way to bring back fertility, and it's really that the frequency that we're looking at when we're looking at how breastfeeding is impacting fertility and hormones. So it's not so much the duration. So if your child is breastfeeding like 5 times over an hour for 3 minutes versus like one time for the same amount of time but continuously, it's that breastfeeding once that has a lower impact on your prolactin levels. So and just hormones in general. So we want to reduce the frequency if we can, if you're aiming to bring back fertility. And you don't need to go hog wild and crazy and be doing all the things at once. You can try just one little thing. So even just spacing out the breastfeeds a little bit. And so, like I said, I have a free guide to say no to the feed while still saying yes to the need. So I often recommend that. And if you can grab it at ownyourparentingstory.com/guide. But that's often a place I recommend starting is okay, just bring a little bit more space. It can be during the day. In between those breastfeeding sessions. So often we're looking for about 4 hours apart during the day and 6 hours overnight. I believe that there's some research to back that up. I know that Sarah Ockwell Smith in her book, The Second Baby Book, I know she quotes a few different ideas around that. But a lot of these are theories that were kind of formulating based on a little bit of data, a little bit of information, and then just the understanding of the science of what's happening in the body as far as like hormones go. So it's hard to
Does
say
it
that there's
seem
hard
like
and
a
fast
few months
rules.
after you make those changes, or is it pretty immediate?
Yeah, I mean, it can be. Again, everybody's different and everybody's bodies are different. So there's absolutely people like I didn't change anything in order to conceive. There's absolutely people who conceive before they have their period, who don't realize, right? And we've all heard the people who were exclusively breastfeeding and got pregnant at 7 weeks or something. So
Yeah.
it can happen, right? And I know it's important to bring that up. It sounds obvious, but when we're in that toddler breastfeeding space, we often forget that. So some of it is just continuing on, and of course there is might be unique things that are happening. Secondary infertility is very real, and so you might need some support. And I talk about that in the podcast series I did. Even I break down looking at different medications and drugs as far as contraceptions go, and as well as fertility drugs and what may or may not be compatible with breastfeeding, and how to have those conversations with your doctor too. So yeah, there's lots of options, and it's not as you don't have to wean to automatically in order to get pregnant again.